assalamu alaikum, good morning, khush aamdeed, ji ayanu, goeiemorgen, pakhair ragle. Well, these are all the words I know. Today you're watching World This Morning with Shiza Hashmi only. It's a Monday morning, beautiful day outside, and I can't say it's a clear day, but it is foggy, misty, and a very cold winter morning. We all love winter mornings. So for all of you who are sitting in front of your heaters with your cup of coffee and a plate of breakfast, brace yourself because you are in for a very informative session. PTV is where we educate you. Dr. Aliya over here. We have sort of, started the discussion of denial by family and how things are changed now because of education. They are willing to send out their children to receive special education. But since I've mentioned that, I have done quite a lot of shows with already persons living with disabilities, and they themselves agreed that the first rejection they receive is not from the society or the schools or their teachers, it's from the family within. So first of all, how do we deal with that rejection, and how do you inform or educate the families as to get out of the denial phase as soon as possible, and then move on with their lives and accept the fact that this is what it is?
Yes. Actually, the problem is that when the families first realize that there's something wrong with the child, obviously they are the first to have that realization. The child was born normally, for example, and growing normally, and suddenly there are some unusual behaviors or unusual, patterns of or problems. So it's actually a process of grief that the family goes through, and denial is part of grief. So it's very difficult for them, and often, especially in our society, they have lots of children. Parents have other responsibilities, and then one child is now is challenged either physically or mentally. So I think it's very, very important that parents need to be educated and they need to be supported and counseled in the right way. But how will that happen? A family, their first contact is with the family physician or the doctor. That's where they first take the child to. So this is where the education starts. I think it's very important that families have to be counseled in the right way and given the appropriate information. Often they are lost, confused, very, very worried because they don't have the right information. Depending upon what kind of disability it is, if you give them the right and a very clear information, Shiza, the other problem in our society is that even our medical professionals, they are very reluctant to give the facts to the parents. If you tell them that this is a situation, this is a condition, this is going to be the prognosis.
As if not to upset them.
Yeah, not to upset them, but that actually doesn't help. In the long term, it doesn't help. If you see a child and if you have identified the problem, the first thing to do is to tell the parents that this is a problem, these could be the potential issues. There could be problems with their education, there could be problem with their general behavior, their social development, their learning problems. So parents first of all have to be mentally prepared, then they have to be counseled. And one more thing, it's one setting or one session is not enough. We have to repeatedly do it. And again, there is a huge role of media, electronic as well as print media in this regard also. And schools, because when at a certain age, when that child starts going to school, if there is a better communication between schools, mental health professionals and parents, and they work as a team, then the parents feel empowered. They are being supported by the teachers, and they are being supported by mental health professionals. And if we work as a team, then the parents feel that yes, they can handle it, they can do it, and then they can guide it. That now whether that child should go to a mainstream school, or if the problem is severe enough that they need help and they need to then seek help for specialized professionals.
I want to talk about the mainstream schools. So that, both of these are sort of what we need to talk about, because there are persons living with physical disabilities who are differently able probably after a calamity or a tragedy, who are intellectually totally fine. So they do not probably need, institutions where special education is given out. They can go to mainstream schools. But there comes the factor of normalization and acceptance and, being stigmatized or marginalized, being frowned upon. How do we deal with that? And that is so common. I can tell you, because I myself studied in a university where there are a lot of people coming with physical disabilities, again, differently abled, but they're not widely accepted. So they're sort of, we ourselves being the common or the normal people, let's say, again, we are sort of pushing them to that margin that you're not one of us. How do we deal with that mindset, and how do we ourselves become accepting of the fact?
Yes, that's the biggest challenge we have at the moment. The thing is, it's all like when you talk about normalization. If we talk about the West, where before, let's say in the early 1900s, they used to have these institutions where people with disabilities were just put there and they were marginalized from the rest of the society. So what happened is in the 1960s, there was this move where they felt that a lot of people were not treated properly in those institutions. They were not given their rights. They had the similar emotional and physical and spiritual needs. So they were not being met. They were all put in kind of one category. So there was this big move where they felt that the more we include these kind of people into the normal day-to-day society, the better it is for them as well as the society on the whole. Why is that? We as a society then accept. So, for example, if there are more schools accepting these children into their, normal, they're doing their admitting them into schools, and they are in every class. We have some of these kind of people or children. The children accept them from that early age. There is more acceptance that. There's nothing wrong with them. They can be as clever, as intelligent, and as emotional as we all are. So this is where we have to start.
Right, Dr. Aliya, there's one thing I need to add, and of course you can sort of relate all of this. The schools over here right now are sort of functioning on the one model fits all policy, right?
Yes.
But that's not true. There are children, especially I know, who belong to probably broken families or troubled families who are not functioning as well as normal children are. They need special attention. They need extra classes, extra attention.
Yes.
Are we going to ever start, prioritizing that model as well, where we cannot just say that one model fits all? Not everyone is alike.
Absolutely, absolutely, and that's a very valid point. Again, I would say that we need to start by educating and kind of creating this awareness in schools, among coordinators, among teachers, where every child should be treated as an individual, and their needs should be assessed as on an individual basis. And here the role comes that how if we better liaise between the schools and mental health professionals, where we can reach out or they can reach out to us. Every school has a coordinator. Usually when there are problems in school and among the children, the problem first goes to that coordinator. If that coordinator is well trained and has better awareness that this is not just a child being naughty or a child being hyperactive, there is something else going on. Let's talk about it. Let's go and have one-to-one with that child. Let's invite the family and talk to them and ask them what's going on, and then involve, if possible, a mental health professional and a psychologist, and sometimes the role comes of a physiotherapist or a speech therapist. So some of these children don't have to go to special education centers. They can be handled and they can be managed in normal schools, provided there is a better communication between the schools, the coordinators, the mental health professionals, and the other allied services. So yes, we need to work towards a system where we have better communication between these different resources, and the most important, I'll use this forum to say this, that parents who are listening to this, they need to reach out and they need to ask for help. If they find something is going on which they're not comfortable with, and they are usually the first to identify that. So they really need to reach out to the right professional and get the maximum information and try and help their child reach their maximum potential. There's nothing wrong in seeking help, and there's nothing
Thank you for saying that. It's okay to seek help when you need it.
It's absolutely okay, and it's actually you're putting your child at a disadvantage by not seeking the right help at the right time. You can actually help that child reach their maximum potential by getting the right help.
Right.
So please reach out.
Now, you know, Dr. Aliya, so when we've talked about the part of role of government and role of the ministries and whatnot, but there's one thing that we keep forgetting, not also families, communities. I want to talk about the psyche of the people like us. And, you know, when we also mentioned that buildings and everything, so whenever we go to a restaurant or any university or any shopping mall or anything, there are so many difficulties that any person with a physical disability or any sort of disability has to face in terms of, you know, exception of course, but accessibility as well. Why is everything commercial? Why does a restaurant have to think we have to build so many stories and look beautiful but not cater to the need of people who might also be coming there? What is the psyche that we're talking about, and how can we fix that? Like addressing the people like us. Please go on and tell them how they can improve themselves to make the people living with disabilities more accepted.
Well, Shiza, it's all about the mindset. Because everything is commercial now, we are catering for the majority.
Right.
And very few people think of the minority. And my role here is to actually educate people about that minority.
Yeah.
And
again,
again,
not consider them as a minority, to be
well,
honest.
minority in terms of it is a minority.
Right, definitely.
So the unfortunate thing is, again, the education has to start from the families, from the extended families at large, and then the society, the schools, and all the other aspects of life. I'm going to take this opportunity to highlight one point. Being a psychiatrist and dealing with people with mental health problems like depression, anxiety disorders, you know, other behavioral disorders, there is so much stigma in terms of even normal people accessing mental health services because they feel that, you know, they don't want to go to a psychiatrist to address these problems.
Right.
Now, the huge concern I have is, what about people with intellectual disabilities? They are apparently they have twofold, or the research says that they have double the incidence of mental health problems as compared to general population. How are they going to access the mental health services at the right time when the rest of the population is not accessing? What I'm trying to say here is, and especially to the families, mothers, fathers, family members who are living with such children, you know, there is often that they have problem with communication.
Right.
I'm especially talking about those children with learning difficulties.
Okay.
So they may not come to you and say, I'm drifted from your question, but it's very important. I need to highlight this. They may not come to the parents and say, I'm feeling low and I'm feeling sad and I'm not happy. They will not say that. The problem and will manifest itself as behavioral challenges. These children suddenly may start becoming very hyperactive, very restless. They may start becoming violent and aggressive.
Right.
So the parents need to understand there's something else going on that needs addressing. Often supporting the child, you know, giving them a hug, and then you know, telling them that everything is okay, it's all going to be okay, you can talk to us.
Be there for them.
And be there for them.
Right.
And also not to forget that if these children are going out, like you said, into the society, into public places, into parks, and they are facing marginalization and bullying, that will be manifesting as depression and low mood at home.
Definitely.
So the parents have to be mindful that what's going on, you know, and those things need to be addressed by accessing the right professional.
Right, very rightly said. Thank you so much for all of you for coming here, Ms. Ishrat, Mr. Jawad, and Dr. Aliya as well. It was a brilliant conversation. Thank you. It was our pleasure to have you. So, ladies and gentlemen, we discussed all the issues that you've heard, of course, and it's actually very amazing to see that the federal ministry is doing a lot about inclusion, and in the future, according to the Vision 2030, we are looking at a very prosperous and better Pakistan. So if there's anything you need to add to our conversation, write to us on our Facebook page, which is with the name of World This Morning. On Twitter, World This Morning without a G, Dailymotion and YouTube, World This Morning, and the repeat is going to be at 11 p.m. Till the next time, stay tuned. Good morning.